I knew I was in for an interesting career.
All right. Good afternoon, ladies and gentlemen. Welcome to another edition of What You Didn't Know. My name is Marcus Bethea, the owner of C3 Wellness. And this week I'm here with both Dr. Orman and our lead massage therapist, Rowland. Um, you guys have anything you want to say to the ladies and gentlemen?
My name is Rowland, and I'll be talking about massage therapy today.
And as usual, I'll be talking about acupuncture today and how the two 1 + 1 = 3 type of thinking, this the synergistic effect of it.
Okay. So we're going to get into the conversation. Now, typically what we do here at C3 Wellness is we have a lot of veterans, a lot of people that come in, whether they're cash pay, insurance based, or what have you, that typically come in for one or the other. And we have convinced people that there's a benefit in doing both. So that's what we're going to focus on and talk about this week is the benefit of both massage and acupuncture together, same day, same time. Go ahead.
When I first started doing this, being here about 5.5 years ago, I didn't know a whole lot about massage. It was mainly just acupuncture, of course. And so when I thought of massage, I thought of, feels good, relaxation aspect of it. I never really thought of the therapeutic aspect of it. And over time, I began to not only understand it and see it, but deeply appreciate the tremendous value that it has medicinally. There is a thought principle that when the lymphatic system, think of it as the dustbin of the immune system. So it's where the proteins and viruses are sloughed off and the body gets rid of it. When it is moving, all is right with the world. But when it is congested, you get anything from annoying things like allergies or colds to horrible diseases we don't want to talk about. And every other system has a pump to it, the heart, cardiovascular, respiratory, lungs, etc. But the lymphatic system depends on the musculoskeletal system. Most people don't always get enough movement, don't always get enough exercise. So what's next in line? Massage. And that's where the work that Rowland and other people do that is so exceptional and so beneficial that it not only feels good, you get the, oh yeah, people come in my room, it's like, what's your name? I'm sorry, what was the question again? and that's a compliment.
Yes.
But the medicinal value of elevating the immune system, and you could take it from here, more.
Yeah.
Yes, go ahead.
So, massage therapy, most people look at massage as relaxation, you know, but that's the main benefit of massage. So, once we get into massage therapy, we're talking about, especially at C3 Wellness, now we're talking about therapeutic massage, where we're not just doing massage just to relax and just to feel good, but we're addressing certain issues like the lymphatic system. For one, we're addressing the joints, we're addressing the muscular system. So we want to create a range of motion for people who have limited range of motion. And massage therapy is the main thing to help with increasing movement in the joints, especially with the lymphatic system. Like Dr. Orman said, the lymphatic system is the only system without a pump. It's very closely related to the circulatory system. It's mainly for uh, enhancing the immune system. So it's like the garbage. It filters the garbage and helps to clean the system, so people can live a better life, to fight diseases, fight the colds. We're always being hit with these things, and the lymphatic system is always fighting for us. So the more we can keep the lymphatic system um, moving, is better for the individual. So it depends on the muscular system. It also depends on the circulatory system, because it doesn't have a pump that would, like the heart has the pump, which is the heart is the pump for the circulatory system, but the lymphatic system works closely related to the um, circulatory system, but it gets its gradient, its movement from the movement of the muscles and of the blood. and it has lymphangions inside of the lymphatic vessels, which are finger-like projections that helps to push the lymph along in the body. So the more we can get people moving, is it's better for us. So people who have swelling, people from post-surgical swelling, people who have problems with their heart and the lower or upper extremities starts to swell, this is where the manual lymphatic drainage comes in, where we do certain techniques to actually move the lymph along in the body.
Okay. And I also want to give a little background to how we got into doing both together as a combination of the wellness that we provide here. I remember we first started treating veterans from the VA, and as they were sending veterans into our facility to be treated for whatever ailment that they were coming in for, I noticed that a lot of people was coming in. They had all kind of excuses of why they, didn't want to come in just to get acupuncture. They were scared of needles. They didn't feel like the treatment was helping. Just all sorts of excuses of why they didn't want to come in for a 30-minute treatment to see if that helps them with their major ailments. So over time, what I started to realize is that, hey, let me give you some incentive to come in here. Why don't we try to incorporate you getting both acupuncture and massage to see if that helps? My limited understanding coming from a transportation logistics background into the wellness industry was that acupuncture sort of helps with underlying nerve issues and deeper tissue issues, whereas the massage helps with more of the on surface muscular issues and things of that sort. So, with my limited knowledge, I kind of figured that a combination of the both would kind of help the overall totality of what they have going on for better treatment. So, little did I know that after experimenting with it and trying it out and seeing what happens with that, a lot of the veterans was getting more relief, and that gave them the incentive to want to come in more often because it was actually helping and benefiting them more than just coming in for one or the other. And then eventually they started getting to a better wellness line a little faster, and it was something that they wanted to maintain. And another benefit from that was it was also getting them off of their medications that they were on, and healing, and their healing process was better. So over time, it just became a staple of what we do here at C3 Wellness. So I thank you guys for providing that service, continuing to add that benefit of getting people back to their wellness line, and we definitely hope to continue that going forward.
So I have noticed that working or speaking with doctors over the years, most of them seem to hate dealing with two things. Number one, pain issues, and number two, medication issues. And fortunately, those are the two at the top of the list for things like acupuncture and massage.
Mhm.
So we can help reduce pain, sometimes eliminate pain permanently, depending on the situation, but also help either reduce the amount of medication or perhaps the frequency, or of course working with the physician who prescribed that, we
Mhm.
can come to a better end result for the patient, because long-term use of XYZ medication will always lead to liver issues. And whenever the liver is involved, pain is involved. Whenever pain is involved, the liver is involved. So you get that loop that never seems to end
Mhm.
unless you intervene. And you can intervene either through manual or through needles. And I think that what I've noticed is that there are certain areas where I could address. So for example, more so the liver and the meridian itself, but not so much the muscle and the musculature. So if there are spasms, my first thought is, oh, there are nutritional supplements that can help reduce or eliminate or prevent
Mhm.
spasms. But currently, what massage therapist is available? And that's
Yeah.
where you guys come in.
So we have people who come in with a lot of muscular spasms, lots. And, they just can't take it because what happens is they can't sleep at night because they're in pain,
Mm.
constant pain. So massage therapy now would actually eliminate most of the spasms. We have patients who come and walk in with a walker or a cane. And once they get the massage for a couple treatments,
Mhm.
they drop the cane. They don't even know. They don't even notice that they don't walk with a cane anymore, you know? And it's just about working, doing what we do best. Most of the techniques that we use, simple techniques, we use to eliminate some of those spasms in the body. And prolonged massage. We do massage on a long term basis. Most people will have reduced spasms in their body, less pain, you know, easier to sleep at night, um, insomnia, less anxiety. Now people can enjoy their lives. People can go on cruises. People can walk, play pickleball, you know, um, exercise, go to the walk their dog. Some people have been in their homes for so long that they can't even get out because spasms. You know, we
Right.
have situations where as soon as you touch somebody's calf, they scream. And after a while, doing some of the techniques like petrissage and effleurage and compression and stretching, friction around the insertion of the muscles help to relax the belly of the muscles. And that alone is so simple that they tend to love us. They say, well, oh my goodness, this is better than medication.
So petrissage, was that the one?
Petrissage.
Is that when you with the Labrador? Or?
So petrissage is a combination of squeezing and pulling the muscle in a repetitive manner. So it helps to milk the muscle of metabolic waste. And what happens is, you know, we do that in a technique like in a session for 3 times. We go over the let's say the gastrocnemius muscle or the hamstring. You know, we go over that 3 times, up and down, from inferior to superior, 3 times. You do that, the muscle tends to just relax. It finds its resting position, resting place after a while. And then they get off of the table and no more spasms. Or if they go back to their regular routine, the spasms come back and then we treat it again. And then the more we do that, the more aggressive we get with the treatment. That's why we tell people come in as much as you can. If you can come in every week, if you can come in every day, people ask me, how often should I get a massage? If you can come in every day for a massage, that's going to help you. But most people, you know, they don't have the time, they don't have the funds to do that. But the massage here is not expensive. So they come in sometimes twice a week, which is amazing. Sometimes they come in once a week. And then you see people walking straight, their posture has improved. They have a smile on their face. They're not as irritable as they used to be when they come in, you know. So the massage, along with the acupuncture, is amazing. So, you know, I highly, highly recommend people to come in on a regular basis and be more aggressive with the treatments that we offer.
And I can co-sign on that. I will say that, you know, a lot of people thinks that massage or acupuncture is more of a luxury service when it really is something that is more geared toward maintenance, continued maintenance, sort of like your medication. So you don't skip out on your medication every day thinking that, oh, if I take it once a week or once a month, I'm gonna get better. So massage kind of falls in that same realm. Hey, if you don't do it consistently, of course you're not going to think that you're benefiting from it, but the more you get it, the more you realize that it's something that is a necessity more so than a luxury.
And there are no side effects to what we do, as opposed to medication. There are no side effects. So the more you do it, is the more you gain. You know, yeah, the more you gain from it.
In acupuncture, our model of medicine that we use and terminology that we use differs, but the concepts, there's so much overlap from what you were describing. Whereas you were describing from a musculoskeletal kind of a Western medicine model, we look at it as meridians, which are basically pathways of energy that originate in a specific organ and then branch off in various directions. For example, the heart. One branch goes down to the small intestine. That's why a lot of times stomach issues mimic heart attacks. Another branch goes down the arms, and another branch goes up to the tongue. So people, for example, who stutter or I can't seem to find the right words, we can strengthen the heart and they can speak their truth, so to speak.
Incredible.
And when you can clear that meridian, or get the chi or energy and blood moving, that's when you have the results that you're looking for. The reduction, not only on the flip side where you get rid of things that you don't want. I want to get that pain issue is usually the number one thing. But on the other side is I gain more energy, I gain more freedom of movement, I gain an improvement in overall immunity, etc.
And it's all natural stuff we're talking about here.
Correct.
You know? So we don't have that, how you call that? Toxic environment being
Yeah.
created in the body.
Exactly. And if anything, we do exactly the opposite, because there are simple things that we'll often recommend. For example, 3-4 ounces of pineapple juice, throw in some cilantro and parsley, whip it up in a blender. It actually tastes good. But one of the things that it does is pull toxic metals such as mercury and aluminum from the kidneys. Simple, tasty things,
Nice.
as well as specific herbs that are combined with acupuncture points, or sometimes we'll do injections of what's called homeopathics, which is kind of a cousin to herbal medicine, into particular points, so that the body then begins to heal itself or begins to clear itself of things that should not be there. And when you look at what has happened to our food and the direction that it's going, it's disturbing, to put it mildly. The body's not designed for this overload. And even, I don't know exactly when it started, but I remember having a couple of vets say, one of the things that they noted when a soldier would pass away in Vietnam is the body would not start to decay for like a week. And nobody could figure out, because it should be, within 48 hours. And it was all the preservatives. And this was back, 1960, late 60s, early 70s. And it's only amplified since then.
Of course.
And then you have, well, we know what we have.
Yeah.
So you strengthen the system and the various organs. You release for example, a lot of times, oh, my memory's going bad, it's age. No, your memory is what it is only because there are metals in your brain that need to be removed. And oh, by the way, we can do that.
That's
Here.
and what people also have to realize too is it's not a quick fix. If you are 40, 50, 60 years old and you've been creating this situation in your body for 40, 50, 60 years, you can't come in for 2-3 treatments and expect to have dramatic overnight results. Yeah, you're going to feel relief, you're going to feel a difference, but it's going to take some time to get to that wellness point, because you took that long getting to where you're at. It's going to take some time to reverse those symptoms.
I do think that the 2 or 3 or 4 treatments that are given, you do get something that is such incentive to continue, because it is the first time. How many times, we can't even begin to count how many times you've heard the phrase, this is the first time I feel relief from, and then fill in the blank. And that's hard to not smile from ear to ear when we hear that.
Yeah. So we're not healers, we're facilitators of healing. So with our touch, we touch people and we're facilitating healing. The body is such that it heals itself, and we're just helping the body to facilitate that healing.
Yeah, we're kind of clearing the static so that the innate ability of healing occurs. Yeah.
Okay. All right. So that wraps up this week of What You Did Not Know. Again, my name is Marcus, the owner of C3 Wellness, here with Dr. Orman, our acupuncturist, and Rowland, our lead massage therapist. Make sure you follow us on our social media outlets, and don't forget to subscribe to our YouTube channel. Until next week, thank you.